There are memories. Once lost, they never come back. One morning, your mother looks you in the eye and asks, "Who are you?" That's not forgetfulness. That's a dementia warning sign, the first strike of an approaching storm. Here on Health First 365, we show you how Alzheimer's early detection can stop senior memory loss before it steals everything. Because when memory problems seniors begin, you are in a race against time. We'll expose the enemy attacking elderly brain health, give you real cognitive decline prevention strategies, and walk you through the dementia care guide every family needs. Don't wait until Alzheimer's symptoms explode. Stay right here. The next 15 seconds could save the memories of someone you love. Dementia is not just a normal part of aging. It's a real disease, silent but merciless, eroding memory, thought, and every skill a person spent a lifetime building. It starts with the little things: forgetting to pay the bills, missing a grandchild's birthday, getting lost on a familiar street. But day by day, the memories, the stories, the relationships, slip away one by one. When you love someone, watching them lose pieces of themselves is like watching them be erased, while they're still sitting right there in front of you. And the heartbreaking truth is, dementia doesn't just change the life of the person who has it. It shatters entire families. It turns children into caregivers. It turns conversations filled with laughter into long, aching silences. But what most people don't talk about are the real dangers of this disease. Dementia doesn't just steal memory, it can take lives. When swallowing becomes difficult, choking, severe weight loss, and malnutrition become constant threats. One piece of food down the wrong way can cause pneumonia, a complication many patients never recover from. And even worse, one day they might open the front door, step outside, and never find their way back. They might stand at a busy intersection with no idea which way to turn. One moment of disorientation, and the outcome can be irreversible. But here's the truth you must hold on to: if caught early, you can win back time. You can have more family dinners, more stories retold, more moments of shared laughter and recognition. The difference between early detection and late discovery can be the difference between years of memories and just a few fading months. Here at Health First 365, we will guide you through the subtle dementia warning signs most people miss. We'll show you how Alzheimer's early detection can help you and your family control the race against time. And we'll explain why understanding memory problem seniors isn't just knowledge. It's a weapon to protect elderly brain health and prevent cognitive decline before it's too late. Remember, this isn't just about a medical condition. It's about love, memory, and the moments you can't afford to lose. The earliest signs of dementia are often so subtle, you might brush them off. At first, it's just misplaced keys, a forgotten wallet, or leaving the kettle on the stove. One day, your loved one might ask what day it is, then ask the exact same question minutes later. They might stop mid-walk, right in the middle of a street they've walked thousands of times, and have no idea where they were going. You might think, it's just aging. But when the repetition sets in, when the same question is asked 3 or 4 times in an hour, when a simple meal requires you to remind them to pick up the spoon, when bathing and dressing become impossible without help, this is no longer forgetfulness. This is a disease taking over every skill, every habit, every part of who they are. In the final stage, dementia strips away all independence. The person may no longer recognize their children, grandchildren, or the spouse they've shared a lifetime with. Moods can swing without warning. Moments of anger and agitation followed by complete silence, their eyes blank as if looking right through you. That's when families realize they are caring for a body, but the familiar person inside is almost gone. But the bigger question remains: why does this happen? The answer isn't simple. Some causes are permanent: Alzheimer's, Lewy body dementia, or irreversible brain damage after a stroke. These are silent attackers, destroying brain cells piece by piece, and modern medicine has yet to fully reverse them. However, there are also surprising and treatable causes. Some people diagnosed with dementia are actually suffering from severe vitamin B12 deficiency. Others have thyroid disorders affecting memory. In certain cases, the culprit is medication side effects or severe sleep apnea cutting off oxygen to the brain. In these situations, timely treatment can restore cognitive function and bring them back to normal life. This is why early medical evaluation is so critical. Because sometimes, you're not just fighting an unbeatable enemy, you're stopping an intruder you can defeat, if you catch it in time. And that difference can change everything. And this is why we should never ignore the smallest signs. Last year in Texas, John noticed his wife, Mary, 68, had begun forgetting recipes she had made hundreds of times over decades. At first, he thought she was just tired. But the forgetting kept happening. Instead of waiting, they went to see a doctor. The results surprised them both. Mary did not have Alzheimer's. The cause was a severe vitamin B12 deficiency and untreated sleep apnea. After 6 months of treatment, Mary's memory improved dramatically. She was full of energy again, back in the kitchen, baking warm, fragrant pies for her grandchildren, just like she always had. Not every story ends this way, but some do. And what those stories have in common is this: someone recognized the dementia warning signs, acted in time, and gave the person they love many more years of memories. Mary's story is proof that sometimes, to save someone's memory, you have to become a detective alongside the doctor. Diagnosing dementia isn't like running a simple blood test and getting an immediate yes or no. There's no single sheet of paper that says it outright. Instead, it's a process of gathering clues, step by step, piece by piece, to see the full picture. It begins with memory and thinking tests. This is where the doctor watches how you answer questions that seem simple or complete small tasks. Sometimes, just a few seconds of hesitation is enough to reveal dementia warning signs. Next comes brain imaging, an essential piece of the puzzle. An MRI or CT scan can show areas shrinking or reveal damage from old strokes you never knew you had. These findings can help distinguish between Alzheimer's and other causes of memory problems seniors. Then, there's the blood work. Low vitamin B12 levels, abnormal thyroid hormones. Sometimes these are the real culprits behind cognitive decline. And if found early, they can be completely reversed. Finally, when the case needs absolute clarity, doctors may order a PET scan, a cutting-edge technology that detects amyloid plaques and tau proteins, the fingerprints of Alzheimer's. Each result, whether it's a number, an image, or a delayed response, is a piece of the puzzle. And when all those pieces come together, only then can the doctor reveal the true picture. Is it Alzheimer's, another form of dementia, or a completely treatable cause? Once the cause is clear, the next question is always, what now? While there's no cure yet, we can slow the disease and preserve quality of life. Treatment starts with medication, protecting brain cell connections and delaying memory and thinking decline. Alongside this, occupational and psychological therapy helps patients adapt and remain independent as long as possible. The living environment acts as another form of medicine. A safe, calm, familiar space reduces confusion and anxiety. This means removing fall hazards, ensuring good lighting, and limiting stressful noise. Physical activity and social interaction are essential. Exercise improves blood flow to the brain, sleep, and mood. Meeting friends, having family dinners, or joining clubs helps maintain elderly brain health and reduce cognitive decline. A diet rich in leafy greens, fatty fish, and whole grains, combined with adequate sleep, forms the foundation for brain protection. Care also changes with each stage. In the early stage, talk more, use photos, music, and stories to spark memory. In the middle stage, assist with meals, hygiene, and safety. In the late stage, they need full-time care, and caregivers themselves must seek emotional support to avoid burnout. Managing dementia is not just medicine, it's a journey of love, patience, and hope. Managing dementia is a long battle. But here's the good news: you can lower your risk, and every choice you make today can be a shield for your brain tomorrow. First, move your body. Just 150 minutes of exercise a week, brisk walking, swimming, cycling, or yoga, can boost blood flow, nourish brain cells, and slow cognitive decline. Your brain needs training just like your muscles. Reading, learning a new skill, playing mind games. These activities stimulate neural connections, maintain elderly brain health, and push back dementia warning signs before they ever show up. Nutrition lays the foundation. Plenty of leafy greens, berries, and omega-3 rich fish not only protect your heart but also fuel your brain. Add to that 7 to 8 hours of quality sleep each night, giving your brain time to recover, clear toxins, and strengthen memories. But even when memory fades, one thing never disappears: love. A warm handhold, a familiar song, can still reach their heart when words are gone. This is the hope, that by acting early, caring for yourself, and loving others, you're not just extending the lifespan of memories, you're keeping meaningful moments alive. Months later, Anna still sat beside her mother on the porch. The autumn air was crisp, golden leaves drifting slowly to the ground. Her mother no longer remembered her name, but when Anna held her hand, her mother gently squeezed back and smiled. That moment, without words, only love, reminded Anna that every second of recognition is priceless. And it's exactly why recognizing dementia warning signs and acting on Alzheimer's early detection is so critical. If you notice someone showing senior memory loss or repeated memory problems, seniors, don't wait. Start the conversation, take them to the doctor, and explore cognitive decline prevention strategies from the Dementia Care Guide to protect elderly brain health and identify Alzheimer's symptoms early. Every day you act early is another day to hold on to a piece of memory, a smile, a warm look. We can't stop time, but we can protect what matters most. If you found this episode valuable, share it so other families can take timely action. Subscribe to Health First 365 for more senior health tips, and explore our other episodes, where we bring you knowledge, inspiration, and hope to live healthier and fuller lives.